If you don't use it, you lose it. Is this actually true? I'm Dr. Rena Malik, urologist and pelvic surgeon, and I see the anxiety that use it or lose it causes my patients. Many of them think they need special exercises to maintain sexual function, but the scientific reality might surprise you. Today, I'm going to break down what actually happens to your body and explain the research for both men and women when you're not having sex. And essentially, we're going to go over what really matters for long-term sex. And make sure to listen to the whole thing, because I'm not only going to talk about what happens to men if they don't use it, but I'm also going to talk about what happens to women if they don't use it. Now, a lot of research will indicate that for both men and women, those who have more frequent sexual activity tend to have better erectile function, or for women, better lubrication, more blood flow to the region, better tissue quality. But a lot of this research is biased, right? Because the people who are having more sex are probably at baseline having better quality health. They're probably having better erections regularly for men, and they're probably having less issues post-menopause for women, like they're having better lubrication and the tissue quality is better. So this is where we're going to break down these myths. Let's start with men. Research indicates that men who have more frequent sexual activity may tend to have better erectile function as they age. But if you think about this carefully, right, guys who are having more frequent sexual activity are probably having more erections at baseline. They're not having as much difficulty. So of course it makes sense that they're going to have better erectile function. What happens to those guys who start struggling with erections? The guys who start struggling with erections, they may tend to avoid having sex because they're embarrassed about their sexual function. They might not actually get help with erections because they're embarrassed to talk about it. And of course, they're going to have less frequent sexual activity. But if all things are equal and you just don't have the opportunity to have sex, what happens? Will your erection get worse? And the answer is no. The reason is because at nighttime, your body protects itself. It creates nocturnal erections, about 3 to 5 nighttime erections every single night. And the reason this happens is the erectile tissue needs this good oxygenated blood to continue to be elastic, to function well, and to have good erectile function. Now, if you start having issues with erections, you might lose those nocturnal erections, meaning you might not wake up every morning with morning wood. And I've made an entire video about morning wood before, so make sure you check that out. But ultimately, that's your first sign that you're not getting good blood flow to the penis. And if you're not getting good blood flow at night and you're not having sex, which causes an erection to happen, and you get good blood flow to the tissues, then you will slowly create what's called fibrosis. That tissue, when it's not used, the tissue will start creating little scar tissue throughout it so that when you do get blood flow, it might not expand quite as much, or it might not expand as girthy as it used to before. So this is where sort of use it or lose it comes into play. If you are getting no erections at all at night or during the daytime, yes, you will start forming fibrosis or scar tissue in the penis, which will then ultimately make it shrink and make it more and more difficult to get an erection. And this is why it's really important, if you want to maintain both penile length, girth, and sexual activity, that you should address it as soon as you start seeing issues with erections. Go see a urologist, talk to them about ways to manage erectile dysfunction. I've made entire videos and podcasts about erectile dysfunction and what you should do about it. I also have a course coming up about erectile mastery. If you are interested in being a part of that course, sign up for the waitlist below and take a survey. Let me know what you want to see in that course while I'm still putting it together. Now, the second thing about use it or lose it is that there's some evidence that when you ejaculate more regularly, there might be an association with a reduced risk of prostate cancer. There was this one very famous study that showed that men who ejaculated 21 times or more a month had a lower association with prostate cancer compared to those guys who ejaculate only 4 to 7 times a month. Now, does this mean you use it or lose it? Like if you don't ejaculate, you're going to get prostate cancer? No, but certainly some evidence to tell you that, hey, regular ejaculation actually might have some health benefits in addition to just getting regular erections. And lastly, regular sexual activity might also help maintain testosterone levels. Now, the relationship actually, like more testosterone means more sexual desire, means more sexual activity. So it kind of is bi-directional, right? You need a certain amount of testosterone to have desire to then have sex. And also if your testosterone is low, it can affect the ability to get an erection. But when you're having regular sexual activity, it also helps sort of send signals that you need to maintain your testosterone levels. And the last thing regular sexual activity can help with is it can help maintain pelvic floor muscle strength, because every time you orgasm, you're essentially causing contractions of the pelvic floor muscle, which can help maintain strength. As I've talked many times before, the pelvic floor muscles are so important for a variety of different issues, including things like erectile function, urination, bowel habits. And so if you want to learn more about the pelvic floor, check out my prior video where I talk about that as well. You'll see all these videos online about things you can do to exercise your penis, but the reality is that you don't need to exercise your penis, you need to exercise yourself, because you need to maintain blood flow throughout your entire body to keep those nighttime erections happening. And to do that, you need to have low cholesterol, normal blood pressure, and not get diabetes. Those are the top 3 causes of issues with erections that are due to vascular problems. More important than increasing blood flow with a vacuum erection device or with medication is to overall work on exercise and diet and stress reduction and sleep, all these different things that can sort of overall improve blood flow, improve your overall quality of life. And I will tell you, the 90-year-olds who come in my clinic who are like, I don't need to see you for erectile function, they don't actually do any special exercises. They have just maintained good health throughout their entire life. Now let's move on to women. For women, there is some evidence, again, just like men, that regular sexual activity helps maintain vaginal elasticity, normal lubrication, and blood flow to the genital tissues. And that these women tend to experience fewer symptoms like vaginal atrophy or dryness. However, similar to the male studies, the women who are sexually active are likely so because they're not having bothersome symptoms that are making them avoid sexual activity. So first off is if you are finding yourself as a female having discomfort in the vagina, pain, dryness, or pain with penetration, it's really important to get that addressed. It is very easily treated with things like vaginal estrogen that can help sort of change the thickness of the vagina and make it thicker, more elastic, more lubricated, and make you feel better. And vaginal estrogen is extremely safe. It gives you just a local amount of vaginal estrogen with very little systemic absorption, and so there's very little risk with it. And you can also, of course, use over-the-counter lubricants and over-the-counter vaginal moisturizers, which can help. If you've been on my channel before, you'll know that the clitoris is just like the penis. The tissues are exactly the same. And so similar to men, women will get 3 to 5 episodes of what we call tumescence or engorgement or blood flow filling the clitoris throughout the night. And this happens, again, whether you're having sex or not, unless you've started having issues that then make blood flow getting down to the clitoris more difficult. Now, this is not as well studied, but I will say that things like high cholesterol, high blood pressure, and diabetes, all of these things can affect blood flow down to the genitals. So again, very important to maintain good health overall and avoid these other comorbid conditions because they will then cause use it or lose it. You might notice then that you don't get aroused as much as you used to. You might not orgasm as strongly as you used to because now the blood flow is less. You can also use things like vibrators that can help increase blood flow to the area externally. And this is a great way to help sort of improve orgasms and at least temporarily improve blood flow to the tissues. I've talked about vibrators before, so make sure you check out that video as well. And again, similar to men, when you have orgasms, you are engaging your pelvic floor muscles. Now, women very often get weak pelvic floor muscles after having babies. So they'll notice things like urinary leakage when they cough, sneeze, or lift heavy things, or more urgency and frequency and not being able to make it to the bathroom in time. So having more sex potentially can help you engage those muscles and strengthen those muscles over time. There was actually even a study that compared doing Kegel exercises to orgasms to see how they improved pelvic floor strength. So you can check out that right here. What I want you to take away is that use it or lose it is true to an extent. If you are not having nighttime, either erections or clitoral tumescence because of your overall health, yes, you will lose it. You will lose the ability to fill blood flow into those tissues and they will get scarred and they will shrink. But this is not an excuse to say that you should be having sex over and over again, whether you want to or not. Now, I think, of course, sex is great because there are so many benefits to it. There is benefit in terms of brain health. There's benefit in terms of mortality. In fact, there's data that shows that people who have more frequent sex tend to live longer. And I talked about that before as well. And you are connecting with another human being. And it's very difficult to measure the importance of connection, but we know more and more that people who are lonely, who don't have person connection, tend to die younger. And there is something very powerful about having that sort of connection and pleasure with another human being. So bottom line, guys, have sex if you enjoy it. Maintain a very healthy lifestyle so that you can maintain good blood flow to your genitals and enjoy pleasure. Guys, I hope you loved this episode. If you did, I want you to do me one solid favor. Subscribe to the channel. It is a zero-cost way to support, and only about 20% of you watching are actually subscribed. So do me this favor, and as always, remember to take care of yourself because you are worth it.